You're watching TVC Breakfast. Nigeria is currently experiencing a population explosion, with the experts projecting that by 2050, Nigeria's population will surpass that of India and China. To curb this negative trend, wife of the Lagos State Governor, Dr. Ibijoke Sanwo-Olu, has urged women to embrace family planning. Mrs. Sanwo-Olu stated that aside controlling the population, family planning will help women space out their children, giving them more time to achieve their goals and empower themselves. She added that it will also help in addressing rising poverty in the country, as there will be less children to cater for. This is the foundation of our next discussion. Joining me now is the CEO of Nigerian Business Coalition Against AIDS, Isaiah Wolabi. It's nice to have you join me this morning.
Good morning. How
Great.
are you?
Very fine. Good to see you.
Good to see you.
Now, the debate around family planning, population control has been on over the years, but it has become more realistic day by day for something to be done about the way that the population really grows in Nigeria. Recall that UNICEF said last year in 2020, in Nigeria alone, we had about 25,000 babies born on New Year Day. This year, it went down a little to about 21,500 babies, roughly, on New Year Day. If you make that calculation and you project, it means we're giving birth to about roughly 7 million babies a year in Nigeria. That's a huge number.
That's huge.
Yeah. So what do you make of all of these?
I think to look at it from a very holistic perspective, population growth can be benefit and it can also be a disaster. So if you look at it from the economic perspective, we need to realize that we do not have the economic means to meet our population demands. And if you look at the Sustainable Development Goals, the bottom line principle is to leave no one behind. And if we must achieve this principle, that means we need to look at the control of our population. So it's not just a health issue, it's an economic challenge. And we need to look at it from all of that dimension. So it's not about cutting population for the sake of cutting population. It's about cutting population so that we can define the principle of sustainable development as what it is.
Okay. All right, now let's narrow it down to the issue of family planning now, for the purpose of enlightenment, for us to know how these things work and you know, placing them side by side. How does family planning help population management, if I have to put it that way?
Well, I think in many ways. Family planning is not just, let's say, for families or about families or something. I always choose or prefer to call it life planning.
Okay.
Yeah, because a lot of times when women are able to space their birth, they're able to make a lot of economic choices at their own pace. And we also need to understand that women's body is their right. So they should be able to decide at what point and when they want to give birth to their child. And also, even for young people, a lot of people think because it's called family planning, it's just for married people. It's beyond that. A lot of young people today are sexually active, and there is a means for them to prevent giving birth. If they have that opportunity, then they should take it up, because countless young people, teenage pregnancy that we have today is on the rise. We have also a lot of young people who are giving birth to children that they cannot take care of. What does that mean? They come into a society where their parent is not even ready for them. Many times single parents that are not even ready for them. Because you see this happen, and the people who pay the biggest price is women. When a boy and a girl have sex and they give birth while in school, the guy can continue his education. But the girl at least has to pull out for 6 months. Many times it's more than that. So you see that it affects the ability of women and girls mostly to live to their full potential. So it's not just about families, it's about our life, it's about our community, it's about the reality of the economic situation, of the health situation of many young girls who could have prevented this.
So Another issue that I'd like to draw attention to that we need to talk about is the issue of our cultures and religion. We know how very attached to these things we are, especially when we feel that, well, God is the one who gives children. So if he gives you children, would you say no? You know, Africans, we like children, and all of that. But how is that helping the situation, or how can we use that to enlighten people to help the situation?
I think the good thing is that so many religious leaders to have joined the campaign of family planning or life planning, as we call it. And that's because they have seen the benefit of it. I strongly believe that our culture shouldn't hurt us. Our culture doesn't want us to give birth to children that we can take care of. So, and the truth is that there are so many things that people have started questioning. For example, there is no God or deity that says that if you don't give birth to more children, you can live to your full potential. If you don't give birth to more children, you probably not get to heaven. If you don't do this, you will not do. So people have started asking more questions. And they have started saying, if I have to give birth to one child and be able to achieve my goals in life, or two children.
Why not?
So why not? Why can't I do this? Why do I have to give birth to 7 children and then I have to put them in different places begging, and then it affects the economy, and then we can live up to the full potential, and then it doesn't even give me the opportunity to serve this God very well. So what can I do? So pastors, imams, and so many other religious leaders also believe in family planning. Some of them are finding unique ways to teach it to their congregation, because they know that religion should not stop our opportunity to have economic prosperity.
All right. Now, while the governor of Lagos State has taken it upon herself to create opportunities for women and for families generally by, putting it on the front burner and seeing how people can get access to knowledge, facility, and the wherewithal for family planning. Now, when it comes to being intentional with this, what kind of policies do you think government should begin to put in place towards this? We recall that sometime during the Babangida administration, where it was, it was mauled that Nigerians would start giving birth to not more than 4 children or 4 babies, and there was a backlash to that. And since that time, there hasn't been that kind of a thought from any government at all.
I think the step that the Lagos State government or the governor's wife has taken is one of the first steps to making sure that, first of all, women and girls and families, young people have access to family planning commodities whenever and wherever they want it at a very affordable price. That's very important. It's also important to improve health communication so that health-seeking behavior will improve. One of the things, like you mentioned earlier, that affect behaviors in adopting family planning is myths and misconceptions. A lot of people would say, oh yeah, when you stop family planning, this would happen to you in the future. This is what it means. A lot of people who have had maybe one terrible story out of millions or hundreds of thousands would say, oh yeah, I used it and this happened to me. But many of them didn't say that, oh, I probably didn't speak very well to a doctor or a gynecologist to advise me on the type of family planning that is good for my body.
For my body type.
Yeah, because it's, you don't just say, I have headache. The headache could come from different sources, and then you pick up a drug and say, this is a pain reliever. It could be pain reliever for a different kind of pain. That's almost how family products are. Family planning products are specific to different body types of women, not in terms of sizes, but in terms of body physiology. So that's why it's important to speak to a trained health workforce. And this should even be part of marriage counseling. It should be part of counseling for young people, for married people, so that they have easy access to it. Churches, mosques should incorporate family planning counseling into how they support couples, young people. That's the first step. And then the government is making provision to make sure that primary health centers across Lagos State and across Nigeria have family planning product, and also health professionals who are trained to do this. This is the way to go. But how do we make sure that we sustain the commodities within this facility so that a woman or a family or a young person who needs this product doesn't go to a facility and doesn't find it? Or how do we make sure they do not meet a misinformed health worker who looks like at a young person and says, you want to go on a long-acting reversible contraceptives? For what? I'm going to report you to your mother. Or do you have a parent? Why are you doing this? You know, people shouldn't face double stigmatization when they go to health facilities. So this is very, very important.
You mentioned earlier when we started discussing that the population of the people can be either a blessing or a curse, and deductively. In the case of Nigeria, where do we belong with the current realities that we find ourselves?
Well, I think that there's a big opportunity for Nigeria in terms of our population. Most of our population today are well under the age of 30. And if you look at it, we have a lot of young people below the age of 24. That's a huge opportunity for us to have advantage of the demographic dividend. But if we do not invest very well in these young people in terms of education, health, employment opportunities, we might be looking forward to a future of demographic disaster. And if you look at history, countries like Malaysia, China, at some point have had this opportunity in terms of demographic dividend where they had huge population of young people, and you see how they have invested in it, and you see what they are reaping in the world today in terms of economic development. It's also a big opportunity for us today. If you look at different sectors and you see how young people are accelerating the impact of development, you see that it's no-brainer. When you invest in young people, you yield huge returns. That's how to see it. So from government perspective, from private sector perspective, and which is what you see when the wife of the governor held the last meeting on family planning, she actually brought private sector organizations together to have this conversation. It's business investment today to invest in young people. See how young people are driving fintech, see how they're driving innovations across different sectors. It's more like put young people here and then you speed up progress almost times 10. But if we leave these young people, I can tell you that they'll be engaged in something else, and that's what we don't want.
All right, now the one-child policy that China adopted at the time for a period of time, which had to keep the population at a certain bracket, and then now I understand they have the anyone who is willing to have 2 children can go ahead to have 2 children. Although Nigeria is not a communist society, but as effective as it was in China, what strategy will Nigeria be putting in place if we want our persuasive approach to be as effective?
I think for different countries, there are different policy instruments that can be used to implement different population policies at different levels. And usually these policy instruments is come across by Ministry of Health, Ministry of Finance, National Population Commission, working together to develop a strategy that is both relevant contextually, culturally, and even in terms of the economic context. So I would say that as much as we can learn from China, just adopting the one-child policy might not be the way to go. Using data to inform our strategic policy decisions is very important. Sometimes giving people education can even enlighten them to know when they should probably give birth. So maybe, for example, and you know that the reality of this is different across the 6 geopolitical zones in Nigeria, which is why data is very important, and why policy should respond to the reality on the ground in terms of data. So the solution to Nigeria would not be something I would just say, oh, this is what I think direct Nigeria should do. But I would say that policymakers, decision makers, private sector leaders should work together and look at what the data is saying across the 6 geopolitical zones in Nigeria to come up with a sustainable solution. Like I said, it could be investment in more education for more families. It could be public enlightenment. It could be making sure that this is family planning commodities available across different facilities. It could be integrating family planning programs into economic empowerment program, because it's definitely very important. But one thing that is sure is that evidence, data, should inform our policy making.
All right, we have to leave it here now. Isaiah Wolabi, thank you so much for your insight into this.
Thank you very much for having me.
Great.